Good afternoon, everyone, and welcome to our Difficult Conversation series. Though talking about Medicare and SHIBA, Senior Health Insurance Benefits Assistance, isn't always complicated or confusing or a difficult conversation, but sometimes we need just that little extra help navigating through these systems and these terms and all of the information out there. So we have better informed information, more informative information to be proactive in our aging. Today, our special guest is Craig Parker. I believe you're retired from Northwest Senior and Disability Services, but he's still very, very much the authority on SHIBA, Senior Health Insurance Benefits Assistance, and of course, Medicare 101. And that's what he's going to talk about today. Thank you, Craig, and welcome.
Thank you. All right. Good afternoon, everybody. So my name is Craig, and I've been doing counseling on Medicare since 2010. So it's been 10 years now. So lots of changes. We'll talk about some of the changes in Medicare. We'll talk about what's happening for 2021. What I was going to do is spend most of my talk talking about this fall open enrollment period. I'm sure that's what you're concerned about, and what kind of things are available and what changes are coming. If you're new to Medicare, that's kind of a different topic. We can get into that also if you'd like. So just flag me if you're brand new to Medicare and we need to talk about that as well. So, all right, I've got some slides. I'm going to see if I can bring those up with the screen share. So this is kind of my title slide. This is our SHIBA booklet on the left-hand side, which is available to the public. It's online right now, that you can link to get the guidebook. It's quite extensive and lots of information. It's really good for someone that's starting out on Medicare, wants to see how things work. So just a little bit of announcement about who we are. SHIBA is a Medicare funded program that's funded out of Medicare that provides education about Medicare and also on healthcare, waste, fraud, and abuse. And I also represent a local agency which has offices in Salem called Northwest Senior Disability Services. And that's where our program resides. And it also serves seniors and people with disabilities with all kinds of things like food stamps and housing and caregiver assistance and Medicaid and so forth. So that's very helpful if you need those kind of services. All right, so let's start out and talk about Medicare. Medicare has 4 parts. Part A and B and C and D. When Medicare first started in 1980, it was only Part A, and they've added medical and they've added prescription drugs, and now they've added a Medicare Advantage option, which is private. Some people call it private Medicare. And we'll talk about those briefly so you kind of have the foundation. Hospital insurance Part A is for hospital inpatient care primarily. It's premium free for most people if you have work history. You have to have 40 credits to get premium free Part A. And the deductible for next year has just been announced at $1,484 per benefit period, which is a 60-day window. So if you go back to the hospital after 60 days, then the benefit deductible starts over again, the $1,484. So just to stop here, this is assuming you don't buy any extra insurance, that all you have is Medicare. These are going to be your costs. So Part A pays for inpatient care, some home health care, hospice, and blood transfusions while you're in the hospital. Doctors and so forth and nurses are separate from your Part A, and that's your Part B. And it does have a monthly premium unless you're low income. And for next year, it's only going to go up a couple of dollars to $148.50. So they just announced a very small increase for 2021. And the deductible is going to go up from $188 to $203 in 2021. That's what you pay up front. And it will pay 80% of doctors, outpatient medical, emergency room, physical therapy, ambulance, etc. There are some no-cost preventive services also as part of Part B. You'll notice on my slides, I'm referencing the guidebook pages. So if you do get a copy of the guidebook, you can see all this stuff in much more details. So that's part A and B. Just a word about preventive services. So when you first start Medicare, you can have a welcome to Medicare preventive visit. And they do a kind of a medical history with you, do some initial screenings for diabetes and cholesterol and that sort of thing. You can get your flu shots, your pneumonia shots under the welcome to Medicare visit. And then you can get referrals for more specialized care at that time. So if you're new to Medicare, take care of that initial visit, which should be free. And then after you're on Medicare, there's a yearly wellness visit, which basically is a review of your medical history, updating your lab tests. They're now doing a cognitive test where they ask you some questions and they check your memory to see if you remember a little story and things that happen in a little story. They give you some health advice. And then you can also be set up for screening schedules for more advanced screenings like colonoscopy, mammograms, and that sort of thing. And these are also free services, although if you're referred to a mammogram, for example, there might be a facility charge related to that. So just to comment, these wellness visits are not physical exams. You have to buy additional insurance to get a quote unquote physical exam. So now I did skip over the initial enrollment period for Medicare. Let me just comment on that. That if you're new to Medicare, you have a 7-month window to sign up for Medicare. If you're not currently signed up, you need to call Social Security. And you can sign up 3 months ahead of your 65th birthday or your first day of disability, I'm sorry, your 25th month of disability, up to 3 months after your 65th birthday is when you can sign up. And that puts you in an initial enrollment period for supplemental plans and drug plans, which we're going to talk about. So what are your options for additional insurance? So just remember, Medicare Part A has that big deductible of $1,400 and some dollars up front for a hospital stay. And Part B has that deductible of $203. Part B only pays 80%. So you're going to have a 20% bill if you don't buy any supplemental insurance. So your options are, and I kind of look at this on two sides of the screen. You've got the left-hand side and the right-hand side. The left-hand side keeps you on original Medicare and allows you to buy what's called a Medigap insurance policy or a standalone drug plan. And the blue box at the bottom there says that if you're employed, you possibly could get an employer plan after you retire, or you could go on the VA system, or you could be under Medicaid. So those are your options if you're on Medicare and you want to stay in the Medicare system. On the right-hand side, your options are Part C, which some people call private Medicare. So what happens is the government is assigning your Medicare benefits to a private company like Providence or Blue Cross or Health Net or Aetna or Atrio. Those are some examples of plans in our area. They're called managed care plans, which means your care is managed through a network. And there's two kinds of networks primarily. There's a PPO network and an HMO network. The PPO is a plan that allows you to go outside the network at an additional cost. HMOs keep you in the network. They're called health maintenance organizations, and they require a referral if you go to a specialist doctor. Your HMO plans tend to be cheaper than the PPOs because you're more tightly controlled on the providers that you can see. And most people, when they sign up for Medicare Advantage, will combine that with a Part D plan that's from that same company. So if you sign up for Blue Cross, you'll have the Blue Cross managed care plan and you'll have the Blue Cross drug plan that's attached to that. So it's combined. The Part C plans pay first. In other words, they're the sole payer of your claims. If you're on the left-hand side, you actually have two payers. You have original Medicare that pays first, and then you have your Medigap supplement that pays second, and your drug plan also pays separately. Let's talk about prescription coverage. It's available when you're first on Medicare, and then also you have a fall open enrollment period, which is October 15 to December 7, and we're right in the middle of that right now. So if you're already on Medicare, you can change your drug plan, and you can change it separately, or you could change it by going to a different Medicare Advantage plan. And the costs are going to vary. You're going to have different deductibles and copays. If you're low income, you can have a reduced premium as much as zero. And most of the plans have what they call preferred networks. So for example, Humana has a drug plan that's called Humana Walmart. And that's telling you that Walmart is their preferred pharmacy, and that's where you're going to get the lowest costs. If you decide not to go with the Part D plan, there's going to be a penalty later in most cases, unless you're low income. Medicaps are what's called supplements or secondary insurance. That was on the left-hand side of my diagram that we were looking at. It pays benefits after Medicare pays. So for example, Part B pays 80%. Your supplement would pay some or all of that 20%. And there's plans A through N. There's standardized benefits throughout the country. So all the plans are the same no matter which state you're in. They're offered by private companies like United Healthcare and so forth. Premiums are going to vary in price, and they're going to go up with age, and they can change every year. So you have to be sure that you understand that as you get older, these plans are going to get more expensive. You're guaranteed to be accepted when you first start Part B within 6 months, or within 63 days of an employer plan ending. So that's particularly important if you're retiring. You've got that 63-day window. And there's a birthday rule in Oregon that allows you to switch to a different plan once a year during your birthday month. Just a caution on Medicaps: if you don't buy a Medigap within the first 12 months of being on Medicare, there are pre-existing condition limitations later on. So if you choose to not sign up for a Medigap initially, after 12 months, it could be much more difficult to be eligible to get into a Medigap. Okay, and in just a few minutes, we'll kind of talk about the differences with the other options here. So the other option is your private option, Part C, which is a private company. And again, you're eligible when you first start Medicare, and also the difference is you have fall open enrollment, which is guaranteed. Part D is combined with your Medicare Advantage in most cases as networks. We talked about the HMO and the PPO. And it is not a Medigap because it's separate from Medicare. It's a primary insurance policy, unlike a Medigap, which works with Medicare. Now, one of the nice things about Medicare Advantage is they're now offering some extra benefits that you don't get with Medicare, such as dental, vision, hearing, fitness, transportation. Some plans are covering over-the-counter drugs, for example, chiropractic care, naturopathic care, some of the things that are being added to Medicare Advantage in 2021. All right, so what's new for 2021? Original Medicare, we talked about the premium going up and the deductible going up slightly for Part B. There's increased income premiums if you're high income. They're adding methadone treatment in 2021. And of course, you've probably heard about the COVID-19 benefits with free testing and some coverage on treatments, which is kind of up in the air right now, but they're talking about it. So with your drug plans, there's new plans in 2021, and there's also some plans that are now offering reduced insulin costs, and they're capping insulin at $35 a month on some of these senior savings plans that have been announced for 2021. For your Medigap plans, Plan C and F are no longer available. Plan F was popular in the past because it had no deductibles, no copays. The F is no longer available. So your most coverage plan right now is G, Plan G. What's new for Medicare Advantage plans? The premiums have gone down, actually, believe it or not, about 8.6% statewide. There's been some more plans added with low premiums. Providence has added a plan. Kaiser's added a plan. Blue Cross has added a plan. Aetna has some new plans for Marion County. And some of the additional benefits that they're offering are listed there: dental, vision, hearing, meal delivery, palliative care, emergency response system, telehealth, etc. And there's that insulin savings program that I mentioned. So those are some of the nice new benefits that are being offered. So just a comment, in the state of Oregon, about 50% of the people in Oregon have Medicare Advantage plans, and about 50% have the Medigap option. So it's really a personal choice as to what works better for you. But the Medicare Advantage plans are gaining in popularity. Okay, so if you're going to choose a Medicare Advantage plan, the most important thing to consider is the network of that plan. So you want to make sure your doctors, including your specialists, your hospital, your pharmacy, your supplier for medical equipment like oxygen, are in that particular network for that plan. That's very important. If you're over under the Medicare with the Medigap supplement, as long as your providers take Medicare, you don't have to worry about anything. So there's really no network on the Medigap side, but on the Medicare Advantage side, there is a network. So you want to look at the plans that are in your area. What's their premium? What's their deductible? What are their copays and what are their coinsurance? That's the percentage that you pay. And kind of think about your own healthcare situation. How many times am I going to need a specialist? How many times do I need a hospital stay? Do I have upcoming surgery? Am I on dialysis, for example? Do I have diabetic care? Do I have a cardiologist I have to see very frequently? Those kind of things are going to be considerations for choosing a Medicare Advantage plan over a Medigap, and then choosing which Medicare Advantage plan is going to work best for you. If you come to see us or you go to an insurance agent, normally they're going to ask you for your drug list. And that's the other consideration. What drugs are you taking? And Medicare has a nice system on their website where you can plug in your drug list and get costs for drugs for all the different plans that are out there. And that's really handy to help you make a choice. Okay, I mentioned earlier that we were in the annual enrollment period for Medicare Advantage, October 15 to December 7. That's where you can switch your drug plan, you can switch your Medicare Advantage plan, you can review your health and drug plan choices, and your coverage begins on January 1st. There's also a 3-month enrollment period, January through March, which just started in 2020, which allows you to make another switch if you're already in a Medicare Advantage plan. You can switch your plan or you can disenroll from your plan. And the reason they're doing that is because a lot of people will sign up for a plan in the fall and they go to their doctor in January and he says, "Oh, I'm sorry, I'm not in the network anymore for that particular company." So Medicare said, let's let people make another switch to a different plan in the first 3 months to make sure your providers are in the network. But you can't switch your drug plan. You can only switch your Medicare Advantage plan. So here's kind of the consideration if you already have a Medigap supplement and you want to switch to a Medicare Advantage plan. You can do that during the October 15th to December 7th window. Unless you're low income, then you can do it year round. Or you can join a 5-star plan year round. And in 2021, the only 5-star plan in our area is Kaiser, which is open year round. So you could leave your Medigap plan and go to a Medicare Advantage on January 1st and cancel your Medigap. And then your Medicare Advantage plan would normally have a drug plan, which would cancel your existing drug plan. And then you have a 12-month window to return without underwriting. In other words, guaranteed return for the first 12 months. This is the Medicare website that we use to create an account for people, and you can put in your drug plans and see what the costs on your particular drugs are going to be for whichever plan or company that you're looking at. It's really handy to do that. And if you go to a SHIBA counselor or an insurance agent, this is normally what they're going to do. Or if you go to Medicare directly, they'll normally use this website to do some research for you. Just a note, I always like to plug waste, fraud, and abuse. Don't share your Medicare card with anyone except the providers that need to see it. Don't give your Medicare number over the phone. Free services are not always free, so be careful. And we also advise don't carry your Medicare card unless you're going to go to the doctor or hospital in case your wallet or purse gets stolen. This is a handy resource for seniors that need help with other things like home health care, housing, food stamps, caregiver support, money management are some of the programs that are available statewide. And that's the phone number for assistance. It's called Aging and Disability Resource Connection of Oregon. And it's a good resource for all kinds of things. We use it a lot to help people find dental plans, for example, dental options. ADRC is a good resource for that.
I want to interrupt a minute,
Go
Craig.
ahead.
We also have several of their little brochures available. ADRC, a brief overview of the programs. And we usually give that out when we have new folks come into town with our welcome packages. But if anybody wants some of that information, just let me know. Also, I was going to say your full SHIBA packet, if anybody needs more information, we can make a copy of that for them also.
Thank you.
So thank you for letting me interrupt.
So here's my slide on where to get help if you're in the Salem, Silverton area. So there's a statewide phone number to call for assistance, and then there's the local number to call for assistance. And there's our website where you can find that SHIBA guidebook that I mentioned. And that's my last slide. I do have a slide on initially enrolling in Medicare. If you're receiving Social Security, you'll be automatically enrolled in Medicare. If you're not receiving Social Security, you have to call Social Security to get enrolled. So for example, people that are working past 65 may be delaying their Social Security. So you need to call Social Security 2 to 3 months ahead of your start date for Medicare. If you call 4 months ahead, Social Security is going to tell you to call back. So call 2 or 3 months ahead is the time frame to do it. So once you know what your specific retirement date is going to be, that would be the time to call Social Security and get the Medicare started. Let me show you the Medicare website because it's really handy. So that's the home screen, medicare.gov, and there's finding plans. Now, if you have an account, you'd click here. Over here is just looking at plans, so we'll do that. And here's where you'd log in, but I'm not going to log in. I'm just going to continue as an anonymous person and just click continue logging in. Here's a nice link if you're new to Medicare. Talks about some of the things we talked about for new to Medicare. So I'm going to click on continue without logging on. So what kind of coverage are you looking for? Here's the Medigap option versus Medicare Advantage. Let's just do Medicare Advantage for the time being. So I just put in Tillamook, and then it asks you if you have any low income type services like Medicaid, and let's just say no for now. Next. Do you want to put in your drug costs? Let's do yes and just do a couple of options for drugs. So if somebody has a drug to suggest, I'll stick it in here. Okay, now it's asking you for the dosage and how many a day. And let's put in an insulin drug just for comparison. Usually people like the injector. Okay, so that's just as far as we went there, that we could just stop there. Done any drugs. Now it's going to ask for your pharmacy. Okay, and I usually put in more than one to do comparisons. We'll put in those 3. Okay, so there's only four Medicare Advantage plans in Tillamook County. There's a new Lasso plan, which has a high deductible. Not real popular. There's another one with a high deductible. And there's MODA, $18 a month. It's not too bad. And MODA has a second plan at 105. And that's it. So let's say you're interested in the lower cost MODA. We click on details. Now you can look at your premium 18. Still have to pay your Part B. In addition, maximum out of pocket is $3,500. That's the most you would pay for care throughout the year. Primary doctor 15, specialist 35. Most of your lab tests are 0. Emergency care 65, urgent care 35. Hospital coverage 250 for each day up to 5 days. That's actually pretty good for comparing plans. Outpatient would be 200. That would be for surgery. Skilled nursing, no charge up to 20 days. Preventive services are covered. Ambulance is 100. Physical therapy, $35. And then I'll skip over the rest here. Extra benefits, they give you a hearing exam, hearing aid up to $9.99 allowance. You get a preventive oral exam and cleaning, fluoride treatment and dental x-ray. And they do give you some comprehensive dental, but it's going to be limited. We'd have to look at that in detail. Routine vision exam. They give you an allowance on eyeglasses. You'd have to look at the details on that. None of these extra things are covered. Fitness benefit. And you can buy optional chiropractic acupuncture for $5. And pharmacies. That doesn't look good. Out of network. Wow. Why is that? It's not showing any pharmacy coverage. Well, that's not good. So I would go back to the first screen there and pick one that does have drug coverage, and it doesn't look like there's anything else available. So you could go with a supplement and a separate drug plan. So you would click this button here. And now you're looking at separate drug plans, okay? So you'd have to buy a Medigap with your drug plan, going this option. And it's going to rank them in order of cost. And your cheapest one is SilverScript, $6 premium. And if we scroll down, your preferred pharmacy is Safeway or Fred Meyer. And there's your costs for the 2 drugs. Look at that, famotidine is 0. And the insulin is not covered. That's because it's showing the full retail cost. So this gives you an example of how you can compare plans. So I'm just pulling up our guidebook here. Here's all your different Medigaps, A through N. And Plan G has the most check marks. See, it's covering everything 100%. except for the deductible. So if you went to the doctor, you went to the hospital, you went to a urgent care facility, you went to, had an emergency room visit, you had an ambulance call, it's all going to be covered. Okay, so what's the downside? The downside is these plans aren't cheap. Here's your plan G. And if you're turning 65, those are your premiums per month. So if you look at our list, Cigna has a pretty good rate. United Healthcare has a pretty good rate. That's just because their pool is a lot larger. This guidebook is really handy.
If somebody wanted the guidebook, they could get a hold of you and you could have one mailed, or is it easier just to copy it off of the website? Or
The PDF is on the website. The printed copy won't be out till the end of the month, unfortunately.
Okay.
But that 800 number is a good one to call.
Okay. This has been great. Lots of information to share. I think people are really going to enjoy hearing what you have to say.
Okay, thank you.
Well, thank you, everybody. This has been great.